I wanted to just do a couple upcoming events for everyone really quickly. We have 2 upcoming webinars we would love for you all to attend. On February 15th, it's our Mujeres webinar. That's going to be for you to come on, tell us, what do you want to see? What programming can we do? What topics can we do for our Mujeres program? We just really want to hear from you so that we can make sure we're providing you with programming and education that you want. And then the same goes for our Bro group. That webinar is going to be on March 1st. Same thing. We really want to hear what you want us to do, programming, activities, everything. We want to make sure you guys are heard and that we are doing everything that we can for you guys. Also coming up March 18th and 19th is our women's retreat. That's going to be at the Marriott Irvine Spectrum. We are, registration is still open, but we are running out of rooms. So if you haven't registered, register soon before the rooms get sold out. We usually do have a wait list for this event, so sign up early to make sure you get a room. And of course, last but not least, camp applications are open. So camp will be July 16th to the 21st at the Painted Turtle. We're so excited to be there again in person this year. As you all know, the camp application is very big application, so we suggest you get it done early, start early, and definitely call us if you need any help. We're here to help you with that application. We understand that it's a lot, so definitely get started so you can get your spot at camp today. And that is all I have tonight, so I'm going to pass it over to Michelle before we start for a brief word from some of our sponsors.
Yes, we want to thank so much all the sponsors that are here with us tonight and all the sponsors of our emPOWERment webinar series. Thank you guys for helping us make this happen. And we want to start with Morgan Westmoreland from Genentech, who has a few words for you guys.
Hi, everybody. Good evening. Nice to see everyone. I'm Morgan Westmoreland. I'm with Genentech, representative for Hemlibra. I'm the nurse educator for Southern California and Hawaii, and I will be sticking around throughout this webinar tonight, and I'll have a breakout room where I'll discuss more about Hemlibra, and I look forward to seeing you all there.
Thank you so much, Morgan. Now we have Albert Maffei from Sanofi. Albert?
Hi, everybody. Nice to see you. Thanks. Hold on. Sorry, I'm with my grandma. My name is Albert Maffei. I'm with Sanofi. Thank you for everybody for coming out today. In the breakouts, we'll be talking about factor levels. So it's something exciting. And yeah, thanks, everybody.
Thank you so much, Albert. And now we have Patrick Wagner from Takeda. Patrick?
Hey, good evening, everybody. Sorry you're stuck with me tonight. Annabelle was double booked, but your lovely representative is Annabelle Garcia, but I am her counterpart over here in Arizona. I have my lovely grass and green golf situation behind me for the Phoenix Open, even though I'm really not there. I know you guys know that, but this is kind of what it's going to look like. Glad to be here. Hope we can get some time in the breakouts to answer any questions you might have. And again, just glad that Takeda is part of tonight's program. Thank you.
Thank you, Patrick. Thank you again to all of our sponsors. And I'm now going to shoot it back to Casey.
Yeah, thank you again to all of our sponsors and everyone. Please stand by after our presentation tonight. We will have some quick breakout rooms with our sponsors to hear a little bit more from them. But now I'd like to turn it over to our 2 speakers for the night. I'd like to remind you, any questions, please put them in the chat and we will ask them after the presentation. So tonight we are going to hear from Josie Gamas from NHF and Lynn Kintz from the Hemophilia Council of California for a great presentation. I'm going to pass it over to them right now and take it away, guys. Thank you for being here tonight.
Hello, everyone. Oh, can everyone hear me?
Yes, you're good.
Okay, awesome. Well, good evening, everyone. Thank you all for joining the emPOWERment webinar. My name is Josie Gamis. I'm the Government Relations Manager for NHF. I will be co-hosting this webinar with Lynn Kintz, the Executive Director for the Hemophilia Council of California. So welcome to everyone here. We are going to discuss ways to better advocate for yourselves and for your loved ones. And we're just going to give you some tidbits, a little advice on how to better get your message across on what exactly, happens in the blood disorder community. And I think okay, here we go. We'll start off with this. I just wanted to give you all a little background. My role at NHF is to help the community members advocate for themselves with legislators, either statewide or federally, but it's also really important to know how to advocate for yourselves on a daily basis, amongst your friends, your coworkers, church members, school. And I think that is the start of where advocacy really begins, to start for everyone. I have a few notes here on how we advocate with our kids at Washington Days or at your Capitol. I always think it's great when you start young. I was recently at a training session in Missouri yesterday, and it was so great to see these young kids out there because these are your future advocates. There was actually 3 generations of families there. It was a grandma, the daughter, and the granddaughter. And it was so great just to see different generations coming through. And it becomes easier to advocate, once you've seen it and you've been in the role. I have on here also, as far as advocating at the legislative level, usually people get really nervous because it's like we're representing like bills and trying to pass legislation. It's not necessarily important to know the intricacies of the bill. You'll have staff members like myself or, like Lynn and staff members for the members of the Capitol that will know the bill. What's important is that you tell your story. And the reason that it's important to tell your story is because you're the only one that can really relay the message to these members or anyone in your community about what you go through on a daily basis. So the more you get comfortable with telling your story, the better it'll be to become a better advocate for yourself and for your loved ones. A lot of the issues that are brought up at the Capitol usually don't really have to do with the bill. It has to do with your story and how these new measures that are putting in place are affecting you, either financially or, just medically. And that's the most important part of telling your story, is letting folks know how this immediately affects you and your loved ones. If you'll go to the next slide. Yeah, these are a few tips that we have when talking to legislators. A little bit of background on me. I used to be a staffer for the Texas legislature. I was there for 17 years. So I worked with House members, speakers, and senators. So this is just kind of a little breakdown of kind of like what to know when you're speaking to members or their staff. Usually you only have about 15, 30 minutes typically to speak with them. So like I said, it is important to know about the bill, but the most important part is to tell your story. And what we always tell our folks, our community members, is it's great to bring either, your kids or, a family member who can relay the story to the members themselves. And it's great for you just to kind of have like a little tidbit, an idea of what you want to say. A perfect example, this is just from yesterday. There was a lady within our community. She's like, well, I'm a little bit nervous to go up there. I'm not sure exactly what my story is. So I said, okay, let's just talk for a second and just tell me a little bit about yourself. Well, 2 of her daughters have blood disorders. And she's like, and I became a nurse just to kind of get more informed about what the needs of my kids would be. And I was like, perfect. That's your story. The more you talk about it, the more you say, the more you can pick out exactly what your message will be. And I told her, I was like, Susan, that's it right there. You just, the fact that you went into this profession to better help your kids and the community, that's the story. And it actually, she did a great job while speaking to the members. And again, we took over the part where we had to break down the bill. But when you go in there to offices and you make, you want to share this, it's important just to realize that these members are, and the staffers are, really busy. So it's important to kind of have an idea of what you're going to say and get those impactful stories out there right away. And if for any reason you don't know the question that they ask you, I honestly think it's even better because it gives us an opportunity to follow up with the offices again. And then again, we get to make that connection. So I think that's another good point to make there. And then I think we have the next slide on there. Oh, there we go.
Yep. So I think the next slide is where I'm going to jump in and tell you a little bit about myself, and hopefully this helps you get an idea of some ways that you might be able to illustrate or tell your own story. So my name is Lynn Kinst, and I'm the Executive Director of the Hemophilia Council of California. So we partner with your local chapter here with the Hemophilia Foundation of Southern California, as well as some of the other foundations that are in California, to really be a voice for advocacy and access to healthcare in California specifically. And a little bit about myself. I grew up in the bleeding disorders community. So my maiden name, or my name before I was married, my last name was Carrie. And my dad was born as the youngest of 3 boys. And all 3 of them were born with hemophilia. We did not really have a family history, but my dad was the youngest and he was born in 1940. So, medical histories and family knowledge of things like that were not necessarily the same thing that it is today. And in fact, one of my dad's cousins has been doing some ancestry research and found an ancestor back in like Scotland or Ireland or something, that there's actually notes in this person's file that they were known as that they were a bleeder. So it's very possible that the family history was there, and it just wasn't something that was really known by my grandmother. But she had 3 boys, and all 3 of them were born with hemophilia. My dad's 2 older brothers, Donnie and Bobby, did not survive to adulthood. They both suffered from brain bleeds when they were quite young. Bobby was actually a teenager, Donnie was a teenager. Bobby was probably only 2 or 3 when he passed away. And my dad was the only one to live into adulthood. He actually had hemophilia B, but it wasn't until he was a little bit older that they even knew that, because at the time that he was born, there wasn't a distinction between hemophilia A and hemophilia B. And unfortunately, he contracted HIV and AIDS through the blood clotting factor that he was receiving, and he died in 1994, which was right about the same time that I was beginning my sophomore year of college. And so all of that history is really a big piece of what has shaped my passion to be an advocate, and my passion specifically to be an advocate for the bleeding disorders community. And the reason that I'm passionate about it is because I do it in honor of my dad. And I also do it in honor of all of our other community members that I've come to know and build relationships with over the years, and to just be part of those efforts. So really, when we think about telling our stories, Josie talked about this a little bit earlier, right? Particularly when we're talking about doing it in the context of like meeting with a legislator, for example, I think that makes us all very nervous. Like, oh my goodness, like here's this person and I have this formal meeting and I dress up and I walk to this big kind of intimidating building. But we really want to encourage folks to step back and think about the fact that we advocate for ourselves every day, right? We need to advocate for ourselves in our workplaces. We have to advocate for our children and teach our children to advocate for themselves in their schools. We have to advocate for ourselves in the doctor's office, or in the emergency room, or at the pharmacy counter, right? There are so many places where we have to be able to tell a little bit about ourselves and why it's important that we get the right treatment, or have access to our medication, or why it's okay for our kid to participate in PE. There's so many of those situations that come up, right? And so it can be really helpful to just think about a few bullet points kind of about yourself, about your family, and think of it like, what would you tell a new friend, someone that you were getting to know, and you wanted to share with them a little bit about yourself and your story. It doesn't need to be super complicated. It doesn't need to be super technical in terms of like all of the medical information. Just share a little bit about yourself, and that will engage and capture your audience, and they're going to want to know more.
Yes, going back to the impactful stories, these are just kind of some ideas of what the visual aids that we usually kind of bring with us when we go up to the Capitol and meet with these members. A lot of folks bring their factor and they bring the vials so that they can show these representatives and these staffers, like, this is what we use, this is what we have to go through. Because once those people see it firsthand, they can kind of now have that empathy, and like, it's hard for them to relate to something that they don't know. So the more you're able to explain to them and show them like visual aids. There was a woman who brought photos of her daughter with the bruising and what was caused by that. That just really brought people's attention, and were like, they were so surprised that, first of all, they have to go through all of this on a daily basis. How much they were blown away to find out how much the cost of these medications were. Once they found that out, I mean, they were really like, wow, how can we help? What can we do to lower these costs? And that's how you get the conversation going. And like I was saying, we went yesterday to the Missouri Capitol, and this is how important advocacy work is. We were there from 8 till like around 4 p.m. And by the time, y'all, that we ended, with our meetings, within different meetings that we were having with members, 2 new members had signed onto the bill there in Missouri. That just goes to show how quickly and impactful the stories were of these folks, that these members were like, we're signing on. So this is kind of why we always kind of push, tell your story, tell your story. Even like Lynn's story right now, this is so perfect, because I'm like, okay, I can see where the passion is now. And that's what we want to relay back to these folks. And this is a very important thing just to kind of remember when you go up there, is you don't have to say it verbatim. It's just like a normal conversation that you're having with a friend. And those are the ones that are most impactful. Like I said, we were so, I don't know, it's just a blessing just to see how quickly the change could happen, and having those members sign up. It was very, very exciting. And so those folks that were new to going in there and speaking with these members, then when they left, they're like, we'll be back next year. And that was like the greatest part, because that's what we want to hear. Because once you get over the nervousness and you get more comfortable, which is what Lynn was saying too, is when you talk about it at school and with your friends and, coworkers, then it just becomes second nature. And again, no one can tell your story better than you. So this is why we always push that. Because once we get that story out, that's when we can receive real change. And that's when, boom, you'll become an advocate yourself. And I think, okay. Oh, I also wanted to mention this. I'm sure maybe some of y'all are aware. We, NHF hosts a Washington Day at the Capitol Hill, and we're having that on March 8th through the 10th. I do believe that the deadline is already closed, but I wanted to kind of keep that in mind for you all, that these are the kind of things that we do. And you're never up there in a meeting by yourself. We always make sure that there's a group of folks there with you, usually constituents of the member, of course, because they want to speak to those people that vote them in. And you'll always have somebody that's versed on the bill. But this is so exciting because we actually get to do this in person. We've been doing things so much virtually that it's so nice just to actually see people like right in front of you. So we're really excited about this coming up in March next month. And so we're gonna have speakers up there. We also do a whole training session where we kind of do like a mock like role playing, like I'm the speaker, you're the patient, come on in. And we kind of walk everyone through that. So it makes everyone comfortable. But if you ever have an opportunity, please sign up for Washington Days. I think it's something that y'all would really enjoy, and we would love for y'all to be a part of it. Oh, and real quick before I forget, while I was there yesterday, we found out, I think Lynn, you told me this too. We got a bill number, it's HR 830. So we will be going to Capitol Hill and pushing that out there to them, letting them know, because what we're trying to do is pass this legislation within all the states. But if we can get it passed in DC, then boom, we can get that help to our folks right away. So, I mean, the efforts are there, and the more community members we have out there speaking to these legislators, the better chances that we have to actually pass it. So again, we encourage you all to definitely try to join either your own state level of advocacies at your own capitals and also in DC.
Thanks, Josie. So we're going to kind of transition a little bit from the federal side and talk about some of the opportunities to be involved in advocacy here in California. So there's just a little bit up here about the council, and I kind of already mentioned this. We coordinate with the other bleeding disorders foundations and associations in California to make sure that folks have access to healthcare. And we have opportunities here in California for you to make sure that your voice is heard as well. So we are going back in person for our legislative days again this year as well. And that is going to be March 21st in Sacramento. And I think Casey just threw the link in the chat if you want to see more information or look about how to sign up to be able to join us in Sacramento. But we have lots of different ways to be involved, and a couple of things that are coming up that relate to what Josie and I have been talking about is this shows the advocacy and the public policy webinar series that we have. Our webinar on February 28th is actually going to be solely on this topic of how to tell your story and giving tips to, you know, kind of help you feel comfortable developing your story. And then on March 15th, which is just before our legislative day, we're going to have a webinar that's going to talk a little bit more about the policy topics that we're going to be talking about at Ledge Day, which Josie kind of alluded to this. So the legislation is that we're working on across the country is about making sure that all copays count, right? So all copays, even if you're using patient assistance or you're getting funds from a charitable organization, we want to make sure that that counts towards your out-of-pocket max and your deductible. And unfortunately, there are insurance plans that are putting policies into place that say, we'll take that money, but then we won't count it towards your out-of-pocket. And it makes it difficult for people to maintain access to their medications. And so we're working on legislation at both the federal and the state level to combat that. So what Josie was just referencing is a House resolution or a House bill that will be, they call it the Help Copays Act, that will be working on that issue. And then we are also working on introducing that same type of legislation here in California, because some, unfortunately, health insurance is super complicated, right? And so some health plans are regulated by the federal government and some are regulated by the state government. And so if we pass the legislation at the federal level, it helps a whole bunch of people who are in health insurance plans that the federal government regulates. And if we pass it at the state level, it will help the people who are in health insurance plans that the state regulates. So some other ways for you guys to get involved. So technically the deadline for Future Leaders, which is our training program for high school age students, just passed. But if you are someone in your family or your household is a high school student and you think, oh, they would really be interested in learning more about advocacy and they missed that opportunity, feel free to shoot us a message at the Hemophilia Council or reach out to us through, Casey and Michelle and the team at SoCal, and we can probably still sneak you in because we're not, it's still far enough out that we can probably still sneak you in. And those teens then participate in our legislative day as well. And then I also wanted to highlight, and I'm going to put him on the spot if I didn't really warn him about this, but Rigo is a community member that is really active with you guys there in Southern California, who also serves on our board of directors and is one of our advocacy and access ambassadors. So Rigo, I don't know if you want to just, pitch it real quick, say anything real fast about what your experience with advocacy has been, but it'd be great for folks to hear from a friend.
Yeah, I don't mind. My name is Rigo Monzo. I have hemophilia. I'm actually in my first year as a vice president with the council. But before that, I was a mentor with Future Leaders. I've done Washington Days. I've gone out to Sacramento also. And last year was the first year being an advocacy ambassador. And the first year was interesting. I got good experience on how behind the scenes really look like when it comes to legislation. learning how to tell your story is kind of like the beginning, but then the advocacy ambassador is kind of like the next level of like actually learning the procedures or learning like your local government and how it operates. And basically, just showing up does a lot more. It's a lot more impactful because people want to, the legislators want to see you right there in their face, asking what it is that that you need to be changed or whatever you're advocating for. And I think it's very important for people that have a specific situation or just being there for someone else that they love, being there for family. I think it's very important to speak up and be involved. If you don't feel comfortable in front of people, public speaking, there are other ways to do it. And I think that these programs do a great job of taking you out of your comfort zone, but at the same time going at your own pace and just figuring out what you're comfortable with and to try new things and to be not afraid to try with other people that might feel the same way. So I think it's a great learning experience. I recommend it for whoever wants to be more involved in public policy or just being there as support your friends or your loved ones. I think these programs are a great opportunity for that and to stay connected with the community, not just for, not just to talk about serious issues, but to also just be there for one another, to stay connected and continue on those friendships. So, yeah.
Thanks, Rigo. That was awesome. So like Rigo said, I mean, you can start small, right? Start by just being involved in your local chapter, being here, and then you can kind of, as you do different levels of advocacy, like you can work your way up, right? And so for some of you that are listening, the thought of like traveling to Sacramento for Legislative Day or traveling even more so traveling to Washington, D.C. for Legislative Day might be really overwhelming. And that's okay. Like, you don't have to start there, right? You start by, getting on a webinar like tonight and learning a little bit about how to tell your story and practicing that at the doctor's office and with your friends and your coworkers. And that will grow over time as you see the value that it has for the community.
I also wanted to add one real quick thing, Lynn. I was thinking for those Spanish speakers that are on, para los que hablan español, también tenemos clases en español que les podemos ayudar. Voy a poner mi información aquí abajo por si acaso es algo que quieren hacer ustedes, que se comuniquen con nosotros y aquí estamos para servirles. So I'll make sure to add that information on the chat as well.
Thanks, Josie. Yes, good reminder. And we do some of the webinars that the council offers. We also have Spanish translation available as well. So both NHF and HCC have resources for our Spanish speakers as well, which is great. So a few other things that you can think about. March is Bleeding Disorders Awareness Month, right? And it is just around the corner. So that is a great opportunity to raise awareness about bleeding disorders. And that just might be, I mean, we do a resolution at the state legislature level, and sometimes people will go and they'll work on, some of our advocacy ambassadors, for example, are working on local city council and board of supervisors type resolutions. But it might be something, maybe you could do something at your child's school during Bleeding Disorders Awareness Month to raise awareness about bleeding disorders, or in your workplace. It could be something in just anywhere at your church or at your synagogue, somewhere where you have influence and opportunity to make people aware. And you really never know. I was interacting with an individual the other day who has a friend who probably has a bleeding disorder, but hasn't been able to get a diagnosis. And it was through her advocacy that our friend even became aware, first of all, that maybe what my problem is a bleeding disorder. And then going to Josie's point about how important it is to sometimes have visuals to your story, she hasn't been getting anywhere with her doctors. And so this board member said, okay, you need to document all of this, take pictures of your bruises, take pictures of what's going on. And we were able to get that information to one of the doctors that works, with us here in California at the treatment centers. And the doctor took one look at the pictures and was like, oh yeah, this person must have a bleeding disorder. Like we need to get him in clinic and like do all the tests to be able to confirm and figure out exactly which bleeding disorder it is. But the pictures alone, like the physician was certain that it was a bleeding disorder. So again, we've been saying this over and over again, right? Tell your stories. There's lots of opportunities to do that. And then just by staying informed, right? You can sign up for email alerts from your local foundation, from HCC, from NHF. And when there are important issues that are happening, sometimes it's as easy as like looking at the email and like clicking a button and like adding your name to an online petition in order to be able to say like, this is important to me, right? We try to make it really easy for people to share those things out. I also always want to mention, because this is a really important part of what the council does, and it is part of speaking up and telling your story and advocating for yourself. If you are having problems accessing healthcare in California, that is the main thing that we are here to do. So if you are, a lot of our patients here in California utilize either Medi-Cal or CCS, California Children's Services, or GHPP to help them access their healthcare. We have great contacts that can help resolve those issues. Sometimes it's a little more challenging with private insurance, unfortunately, but we have figured out ways to navigate that as well. So we just always want to make sure that that you know that resource is available to you, and that might look like unexpected costs related to your healthcare that are creating a barrier. It might look like, cancellation of insurance. Maybe you're changing jobs and you're not sure which insurance to choose. There's lots of reasons and things that you might run into, but don't feel like you have to deal with those things alone. That's part of, speaking up and advocating for yourself and availing yourself of the resources that are available.
And going back to this, the community is like our number one reason why we're here. And together, there's different issues that happen within the community. That this is why we're here, so that we can get through this together. That's why I was also wanting to mention, as far as the Spanish language, we actually at NHF have a whole department that's dedicated to Spanish speakers. I'm from Texas, so mine comes out very Tex-Mex sometimes. That's how my Spanish comes out, but we do have people on staff that can help you all with that. And we actually have a Puerto Rico's chapter who's been doing so much work on the island, and that's not stopping them either. They are at Washington Days. They are coming up there and speaking to the legislators as well. So we want to make sure that it's an open forum for everyone. And again, we thank you all for everything that you all are doing, and we're here to help in any way that we can. So definitely reach out to us if there's anything that that you're having issues with, like Lynn said, or just questions. We're here. If we don't know the answers, we'll find them for you, especially within our teams.
So
and there's a link.
Yeah, I was just gonna say, I think we wanted to just open it up to questions and discussion, right? So if folks have questions about the information that we shared, or maybe you've heard things in the news about stuff related to healthcare that's happening at the federal or the state level that you've been worried about, you're wondering how it's affecting people with bleeding disorders. We would love to dialogue about those things, answer questions, or hear what you guys are thinking.
Yeah, we have a few questions, but I want to remind everyone, feel free also to just throw in the chat. And we'll get to those questions, but I was wondering first if we could expand perhaps a little bit on HR 830 a little bit, just to let everyone know a little bit more about what that is.
Yeah, so it's basically like Lynn said, it's a copay accumulator bill. So what it does, it just makes sure, they used a perfect example at one of our training sessions that I thought was really great. It's basically making sure that the insurance companies aren't basically double dipping. So if you go in there and you pay, what your deductible is for that month. And so you're thinking that you're putting this money towards that. So you come in with any kind of assistance, they are assuming that because it didn't come directly from you, the patient, then they can go ahead, that doesn't count, but they still take those funds from you. So this is what that bill is basically trying to do. And it's the same bill that we're trying to pass in every state. The one in the DC is the one that we're trying to pass federally. So what we are trying to pass it in every state so that we can, when we do get up to DC and we talk to these Congress people, we can let them know, look, this bill's already passed in your state. So, we have the support from your people back home. So, there shouldn't be a reason why you shouldn't vote for it. As of right now, we have 16 states and Puerto Rico that's already passed this bill. And we are within the NHF team, HFA, and your local chapters, we're going up to every capital and trying to make sure we push it in each state that we go to. So I'll be on the road for the next 3 months, maybe every other week, trying to make sure we get that done. So that copay bill is basically the same thing that you will be passing in your states, but it's now at the federal level. And we're really excited because we just got that bill number recently. And so when we go up to DC, we'll be ready to knock on those doors and let them know. And usually when we meet with those members, we make sure we have somebody from each state going to meet that particular representative. And we'll have like printouts and background and leave behinds of what exactly the bill does. And then again, the most important part is when we go up there and we tell these folks your stories so that they can put a face to the number of the bill. And that's really how it becomes impactful. And that's how we get the change going.
And I would just add to that, because the language around this issue is really confusing for people, right? It's this copay accumulator adjuster, like who the heck knows what that means, right? And so a lot of times people have experienced this, but they don't know that they've experienced it. So the situation would most likely occur if you're using patient assistance in order to help access your medication. And the most common way that you would see this is you use your patient assistance and you're able to get your medication for the first, 2-3 months of the year, give or take. It really depends specifically on your insurance coverage and how much your medication costs, et cetera. Use it for a few months. And then suddenly, when you thought that you would be at the point where you weren't going to have to pay anything more anymore, your pharmacy says, oh, you owe, it could be a couple $1,000s, it could be $5,000. You owe this amount of money before you can get your medication. And you think, I thought I used patient assistance. Why am I owing money? That is most likely what is happening to you, is that your insurance has implemented one of these adjusters, copay accumulator adjusters, and your the patient assistance you were paying did not count against your deductible. So if patients have experienced that specifically, we would love to hear from you, because we definitely need more patient stories in order to help bolster our efforts both at the state and federal level to get these policies, to try to eliminate these policies.
Lynn, that was going to be part of my follow-up to you, was what can we do for, to help in California? So would that be if we've experienced that, getting in touch with the council so that we can put together all of the stories to present to the legislators?
Absolutely. So I would say that there's a couple of ways that folks can help. And that's probably one of the best ways, right? So if you have experienced something, or you think you may have experienced something like a copay accumulator, we would love to hear from you. And really, we would love to hear from you for 2 reasons. One, because if you are having trouble accessing your medication, as I said before, we want to try to help you resolve that issue. We want to make sure that you're getting what you need in order to stay healthy and active, and be on the medication that that your doctor has prescribed. Secondarily, even if you have not experienced that, you can tell, again, like we were saying, you can tell your personal bleeding disorder story and why having access to your medication is so important, and why it needs to be, handled in a way that you can afford. And that can still bolster our efforts to support that legislation here in California more broadly. And We don't have a bill number quite yet, unfortunately. It's been a little bit of a process here in California, but we're hoping we will have a bill number here in California by the end of next week, because that's the bill introduction deadline. So fingers crossed that we're able to get the bill introduced as we hope, and we should have a bill number. So we will have a bill number before Legislative Day, and this will definitely be one of the issues that we'll be bringing up during Legislative Day. And we will do that for everyone that's able to be in person in Sacramento. But even if you're not able to come to Sacramento, we will be creating one of those links that will make it easy for you to send your support of this legislation to your legislator. And that's something that, we'll gladly share out, like through, pass along to HFSC so that you guys can share it out to folks that might be interested in that information.
Yeah, great. Thank you. I did see Patrick had a hand up. Patrick, did you have a question regarding the bill?
Yeah, thanks, Casey. Actually, just more of a comment, to Lynn's point, we've definitely seen some patients through our hematology support center that have received letters from their insurance company, and they weren't sure what it was. And it had to do with the copay accumulator. So when they're getting this from their specialty pharmacy, ultimately they were advised by their insurance company. And that is a difficult place for them to be in. But just to be very cognizant, if you're getting something from insurance, it could be something referring to this. And heads up, utilize all the resources Lynn and Josie are talking about. If you have a question, do something about it, right away. Yeah.
And that's kind of a good point. And I'm just going to add on for two reasons right now. I mean, there's this type of stuff going on with insurance. But but there's also things going on with Medi-Cal and CCS and GHPP with what we're referring to as the redeterminations, right? So during COVID, all of those health system supports, they were not able to ask you to they were not asking people to fill out paperwork to check on their financial status and potentially say, oh, you're no longer qualified for these services. And that is ending in April, where they're going to be able to do that again. And so my summary point on this, and this is the easy thing for everyone to take home and remember, whether you have Medi-Cal, CCS, GHPP, Medicare, private insurance, however you're getting your healthcare, if you get something in the mail from that entity that is providing your insurance or is related to providing it, make sure you read it. Don't throw it away. Or if you get an email, read it. Don't toss it without looking at it. And if you don't understand it, if you get it and you're like, I have no idea what this means, the temptation for me when I'm like kind of overwhelmed by something like that and it's confusing is sometimes to just like put it aside and think, okay, maybe if I ignore it, it will just go away. Don't do that with this health insurance stuff, because it could put you in a really difficult situation if you don't respond timely. So take it to if you're at an HTC, take it to your HTC nurse or social worker. They are great resources to help you figure out what to do with it. Bring it to your chapter, contact me. You have places to go to figure out what is this letter that I got mean and what do I need to do about it to ensure that I maintain access to my doctor and my medicine.
Mhm.
Great. Thank you so much. So I have a few other questions. These are more for once you're meeting with a legislator, perhaps. You talked about it's always great to follow up, but what do you suggest is the best way? Is it to do written thank you notes? Is it to do an email, phone call, all three?
Yeah, I say all three. That when we left the Capitol yesterday, those thank you notes they go a long way, just because when you're in session and a staffer and a member, you very rarely get thank yous. So it's always good just to let them know that we appreciate your time. Thank you again for meeting with us. And it's just good just to kind of keep our organizations in the forefront and letting them know that we're here. So any way we could get our name out there again, just even at the end of your meetings, just to say, thank you very much for meeting with us, and that follow up. I always like that, like I mentioned earlier, if you don't know the answer to something, that's even better, because it allows us to call, to reach out to that office and be like, our folks met with you. You had some follow-up questions. We have some follow-up answers. So just as long as you keep that communication going within those offices, that's great. And also it's really good when you have freshman legislators that don't really, this is the first time that they're in session. It's good to get to know them because sooner or later, they're always going to move up politically. One day they're a House member, one day they're, a senator, and then they'll end up in DC, but you've already formulated those relationships with them. So that's always great. I have several states that have passed the copay bill. And so for their capital advocacy days, they're like, well, what do we do? I was like, you keep showing up, you keep going out there and just letting them know, hi, we're here. Thank you very much for meeting with us. Because, what we're doing is just, moving the needle. What our fight today might not be the same as tomorrow, but as long as we keep the advocacy out there and letting them know we're here, our voices are going to be heard. So any way that you can follow up with them, I think is a great idea. Email, call them, thank you notes, all of that.
I used to always say too, if you met with the staff person, which is very common, but you want to make sure that the issue gets in front of their boss, write a letter, or a short note. It could be, and it really could be an email, or it could be a handwritten, or it could be typed up, whatever. I don't think that the format matters so much, but if you write something that's really complimentary towards the staff member, they're very likely to, thank you so much. Your staff person was so amazing. They took so much time with us. However, be honest, be truthful about it, but the more glowing you can be about the staff person, the more likely that letter is to actually get in their boss's read folder. And maybe you can work a little bit of your story into that letter, right? Because if I was also a Capitol staff person here in California, like Josie was, right? I worked for a member, and those staff people are picking and choosing what's going to go in their boss's folder. So if you say something really nice about the staff, they're likely to want their boss to see it.
That's a really good point. And that would work. Yeah, I'm gonna take that one because I actually used to do that. I'll be like, look, all the nice things they said about us.
I think that's a great tip. Thank you. That's really smart. So my next question is visuals. We know that visuals are great. I know, having been to Washington Days, they really love seeing the visuals, but how many do you suggest bringing? So now both of you've been on the other side of it as a staffer. When does it become like too much? Like, do you bring the medicine and no pictures, or no medicine and just a few pictures? You don't want to overload them. It's not total show and tell time. What is your opinions on that?
I just think, I was like, whatever you're comfortable in bringing, I think. We had a lunch and learn here in Texas, and when they would bring out the little vial, and one of the community members said, do you know how much this costs? And as soon as he set the cost amount, there was literally jaws dropping from staffers because they could not believe that. And then when they found out how often they have to infuse. So I just think visuals are great. I mean, the more the merrier, of course, anything that you're comfortable with. But yeah, you should have seen the faces of those folks. They couldn't believe it. And so that's why I always think visuals are always good. And you know what the best visuals I think are little kids. When you bring those kids, nobody can say no to those cute little faces. And then again, you're bringing generational advocates, because, they're going to grow up, and then we're going to keep the message going. So, and the more they see that you're comfortable, the better that they are. And some of these kids end up being our best advocates when they're talking, and the members remember them, and so I think, all of that is important. And I think, whatever you feel comfortable in bringing, but definitely I think is a good thing.
Thank you. And I think we're on to our last question of the night. But so this is, I guess, maybe a piece of advice, especially if it's someone's first time telling their story in front of a legislator. It can be kind of daunting, especially if you walk in the room and, oh, it's the legislator, it's not just a staffer. What is some advice for if you can't help it, but you completely blank? All of a sudden your story is gone. You don't remember what you're supposed to say, or you start losing track of what you were going to say. And now you realized you're on a cycle of just rambling on and on. What is your advice for how to get out of that, or what to do?
What's tidbit? So actually, this happened to me yesterday. I was walking in, I was just getting, they were in session, so I was just getting used to talking to the staffers. And at one point, the gentleman goes, "Oh, the member's here," and I was like, "Oh, really?" So when I walked in there, a great starting point is I always ask, or have the membership or the community ask, pardon me. I was like, "What do you know about blood disorders, or do you know anything about it?" And one thing you all do know is that everything about it. So I think that's a good little icebreaker to kind of put out there for them, because some people may know, some people may not know. And one thing that, like I said, that you do know is about it. So I think they'll become second nature. So that's always my little go-to. Just always ask, do you know anything about blood disorder patients or the community? And that kind of opens it up for a conversation. Do you have any tidbits, Lynn?
Yeah, no, I was gonna say that's a really good tip. If you've already, I think anytime, like, you can ask them a question, see if they have questions for you, right? Like, you can always sort of pause and say, let me pause there, and what questions do you have for me? And the thing that I would encourage you is, like, these folks, whether they're the members or the staffers, it's very rare to have like a grouchy, mean person in that role. They pursue this because they want to serve their constituents.
Mhm.
The people who work for them are like, inspired by public service. So generally, especially when it comes to, constituents, people who are coming up for a legislative day, they're very friendly and supportive, and will kind of help you out as you go. And then the other thing I would say is, if you are doing it as part of legislative day, whether it's in Sacramento or in Washington, D.C., like Josie indicated earlier, you're always part of a team, right?
Mhm.
So you're not going in there by yourself. And so I've definitely had situations where it's like somebody has like looked across the room to someone else and been like, you kind of can look at your teammate and be like, rescue me. I need, my brain, I just went blank. And somebody else can kind of jump in and help you out. So you don't have to feel like, oh, I'm in this alone. And like, if I blank, then the whole thing's going to be a disaster. That somebody else can help you out. And if you do get stuck, at sort of pausing and just asking them if they have any questions is always a good thing, because then they'll ask you something and then your brain will usually start working again when you can focus on answering their question.
Yes, thank you so much. I think that's great advice from both of you. And I want to thank you both so much for taking the time to be here tonight, sharing with us. I think this is great information, great way to kick off the emPOWERment series for this year. So I do appreciate it. I know, Josie, you put your email in the chat. I know we also, I think, Lynn, please feel free. And we have the link to legislative days for anyone who, needs to get in contact. Please feel free. So I want to thank you both for coming tonight. We appreciate it so much.